Thank you, Dr. Mohan and Dr. Jaya, for setting the stage and telling us about quality and accreditation. I would like to share about one of the standards that I came across recently. So I was in Nairobi in April of last year, and there I met people from Safe Care. They have developed some standards, and at that time the feeling was, wow, we need something like that here in India. So let me just introduce that and see if we can, take it forward from them. So SafeCare was co-founded in 2011, and it's an amalgamation of three organizations: Joint Commission International, Farm Access, and COSASA. They have a lot of experience in developing standards and implementing standards in developed countries, especially in the US, and they certify hospitals internationally. But they wanted to develop standards which were suitable for resource-restricted settings in developing countries where there are not so many resources to have a lot of facilities. How can we still talk about quality and accredited clinics in such settings? So they developed standards which can assess a wide variety of practice settings, and that could range from just a small 10 by 10 shop to a large hospital and anything in between, and private, charitable, government organizations, all can be actually assessed by them. They have two levels of assessment: an advanced assessment and a basic assessment, and the organizations can choose where they want to start. And what I really liked about this is that they don't just tell you where you are at, they also help you develop a plan. Okay, how do you get from level 1 to level 2 and from level 2 to level 3 and so on. So there is a continuous quality improvement cycle that starts up in the organization and with this quality improvement plan. So they have these 5 levels of accreditation for primary care organizations. Level 1 is very, very modest quality strength, where the organization is just starting to think about quality and implement the quality standards. Whereas level 5 is where there is a continuous quality improvement, process in place within the organization that is improving quality, talking about quality. Everyone in the organization is committed towards the quality. They have in these quality standards elements, and these elements refer to different aspects of care and management in the organization. And I like this because they not only talk about clinical, in which there is only 2 heads: primary healthcare services and inpatient care, but they also talk about management and support services that support the clinical side, and ancillary services, which includes housekeeping and cleanliness services as well. And those are essential parts of our quality in any healthcare facility. So each element is further subdivided into subcategories. For example, I took up the page 1 of service element 6, primary healthcare services, and they start with organization and coordination. And the most important part in that is the service is organized to provide a safe and effective service and is coordinated with other relevant services in the referral hospital and in the community. So we as solo practitioners often don't think about referral and coordination, but our role as family physicians is also to coordinate care for chronic care or for elderly patients, so that they do get quality care wherever they go and they are connected back to the family doctor. Same 6.2 starts talking about facilities and equipment and so on. These standards are actually available on their website and they can be downloaded from there. So they are present in several countries in Africa and have helped a lot of different organizations assess their quality and improve their quality over time. These are their current statistics. They have more than 2,000 active clinics in the program. And their accredited clinics see almost 2 million patients every month. You can, of course, go to the website to learn more. What I liked about their approach is, one, that the standards are developed for low resource or resource restricted settings, like we want in India, where primary care can be delivered in a very remote rural area, as well as in a, we saw some pictures of the swanky clinics in the metros. And all of that is primary care. All of that is within the scope of what we envision to be the AFPI standards. Second thing is that they provide us a process for growing from stage 1 to stage 2 to stage 3 and provide support along all the way. Another good thing about their standards is that they say that you should have a malaria protocol in place in your clinic, but they don't specify which malaria protocol. So there is a lot of variation in primary healthcare all over, with the world. Let's not just say India or developing countries even, and they recognize that. And what they're saying is that you should have a protocol in place. You decide what protocol it is, but you should have some. We have been in talks with them recently, and they are very interested in partnering with AFPI and getting these standards implemented in India. So we would love to hear more from everyone here as to what they think about safe care and accreditation in general.